Welcome to this edition of Ageing Matters. As National Reconciliation Week draws to a close, I acknowledge and pay respects to the past, present and future traditional custodians and elders of this nation and the continuation of cultural, spiritual and educational practices of First Nations people. National Reconciliation Week is bookended by two significant milestones on the journey to reconciliation. On 27 May 1967, Australia's most successful referendum saw more than 90% of Australians vote to give the Australian government power to make laws for the Aboriginal and Torres Strait Islander people and recognise them in the census. On the 3rd of June 1992, the Australian High Court delivered the Mabo decision, the culmination of Eddie Mabo's challenge to the legal fiction of terra nullius, that is, land belongs to no one, and leading to the legal recognition of Aboriginal and Torres Strait Islander peoples and the traditional owners and custodians of land. This decision paved the way for native title. Reconciliation must live in the hearts, minds and actions of all Australians as we move forward, creating a nation strengthened by respectful relationships between the wider Australian community and Aboriginal and Torres Strait Islander people. I was in Bundaberg yesterday emceeing the Seniors Expo, which brought together approximately 120 people from the Bundaberg community with government agencies and service providers. The welcome to Tarabulong country was provided by Uncle Willie Broom, followed by presentations from the member for Bundaberg, Tom Smith, Senior Constable Brittany Duncan and Senior Constable Dave Didsdale from the Queensland Police Service on safety at home and in the community, and Bob Walker, a Community Engagement Officer with the Office of Fair Trading, talking about scams and frauds. I spoke about COTA Queensland's role as the seniors peak and how we are engaging with people as we age in Queensland to inform government's policies, programs and outcomes. We recognise that some issues are national, some are statewide, whilst others are local. COTA Queensland works with all three levels of government, and in Queensland we have a memorandum of understanding with the Local Government Association of Queensland to work towards an age-friendly Queensland. It is predicted by 2050 that more than 1 in 5, in fact 22.1%, or 1.8 million Queenslanders will be aged 65 years or older. Bundaberg already has 24.6% of its population aged 65 or older, so Bundaberg Regional Council should be leading the way in ensuring that services are meeting the needs of its older population. We heard that cost of living was a major issue, as well as housing. It's estimated that 2,000 people a year are moving to Bundaberg, and this is causing real housing stress, with older renters finding it very difficult to locate affordable housing that meets their needs. This week we welcome yet another new staff member, Rose Harris, as our Volunteer Engagement Manager. Rose will be travelling throughout Queensland over the coming months to recruit senior mentors who will contribute to the training of personal care workers. The mentors will provide guidance in delivering person-centred care to people who are still living in-home but require in-home support. The mentors will also provide input into our policy and advocacy work based on their connections to their local communities. Next week, I'm speaking at the U3A Network Queensland State Conference, so we'll have the opportunity to meet with delegates from 35 universities of the third age from across Queensland. I'll be speaking about COTA Queensland and what it's doing to meet the outcomes of the United Nations Decade of Healthy Ageing 21 to 2030. Their actions are changing how we think, feel and act towards age and ageing, ensuring that communities foster the ability of all older people, delivering person-centred care and primary health services that are responsive to older people, and providing access to long-term care for older people who need it. Healthy ageing is a dynamic process embracing all older people and requires a whole of society approach. Whilst on the subject of healthy ageing, did you know that shingles vaccine is free for people aged 70 years through the National Immunisation Program? People aged 71 to 79 can get a free catch-up vaccination until the 31st of October 2023. Shingles can cause severe nerve pain that can last for months. In fact, I was talking with someone recently who had shingles, and they said that it still affects their eyesight. Shingles is caused when the chickenpox virus reactivates. So if you can remember how uncomfortable chickenpox was, and you haven't had your shingles vaccination, I suggest you contact your GP now and get your free vaccination. Also, don't forget to get your flu shot. Influenza is especially serious for people aged 65 and older. Stay safe.